Hello, good morning, and welcome to the Information Command Center as St Lucia continues to respond to COVID-19. I am Lissa Joseph. We're here for a very special press conference, and we say that all the time, but indeed, once the information is coming through, and you'll understand today why this is a special one. We are continuing in the heightened efforts, and this one will take us into the realm of some real action that is taking place within the Ministry of Health when it comes to being able to do contact tracing and to better facilitate, as well as to help you better understand what is required of you and others when it comes to home quarantine. We have in studio with us the surveillance officer within the Ministry of Health, Dr. Dana Gomez, the principal nursing officer, that should be Nurse Julita Cassius, and joining us via Zoom is the developer and a graduate student and researcher at Howard University, and that is Khahlil Louisy. We'll be getting to our guest very soon. We also want to say good morning to our media partners joining us via Zoom. We do have Stan Bishop, who is online with us from the SLU Marketing, NBC Television, I believe in the person of Rihanna Isidore, and the Choice Television in the person of Nelsia Schalmine, and Radio Caribbean International in the person of Tiva Callium. Thank you so much. We'll be getting to all of your questions, and as well, we're hoping that the other media partners will be able to join us. Let's contextualize our conversation for today. Yesterday, we did learn of a third COVID-related death. The individual, an 83-year-old male from the Sufra district, and he was diagnosed with the COVID-19 virus on November 22nd, 2020, and he was being treated for other health-related conditions. The Ministry of Health also recorded 8 COVID-19 recoveries. To date, we now have a total of 177 recoveries in country. We also recorded a new case, unfortunately, a 10-year-old boy from the Cassius district. Now that brings the new total of active cases in country at the moment to 91. That's as of yesterday. And in total, from March 13 to December 9, the total number of cases diagnosed in country is 271. Now, once we have cases that we've recorded, positive cases, we know that there's a flurry of activity that happens within the Ministry of Health, and that activity is centered around the contact tracing team. It's not a team that we hear a whole lot about, except just in the press release, and we're never able to really discuss and really fledge out what exactly it is and how the contact tracing works and what it does. And I can tell you that the contact tracing, that all of the successes that we've had, we can owe a debt of gratitude to the contact tracing as well. So we are here to discuss a contact tracing app that has been developed for St. Lucia. So we are going to start with Dr. Gomez. Dr. Gomez, in terms of the contact tracing app, why did we feel it was necessary for us to come up with one?
Okay, as you've just contextualized the situation in St. Lucia, so at present, to date, we've had 271 cases, we've had 177 recoveries, we've 91 active cases to date. We've had 3 persons who of COVID-related deaths. So basically, if we look at the epidemiology of this, we're seeing that our reproductive rate at present is 2.3 or thereabout. Previous to that, at the end of November, it was at about 3 and above, close to 4. But it has decreased presently with a decrease in the number of cases. And for the epidemic to be controlled, we need a reproductive rate or RT to be below 1. And this is where contact tracing comes in, which is a measure that is adopted in the control of epidemics and outbreaks. So contact tracing has been around for a very long time. It has been used in in the control of different outbreaks. For example, the SARS outbreak, the MERS outbreak. It has been used in the HIV epidemic also. Currently, it's also used in tuberculosis because tuberculosis is endemic to St. Lucia. So contact tracing is very important in order to control the outbreak, as well as other measures. But so we found it, the government found it useful that apart from our contact tracing efforts, this app also be added to aid our contact tracing efforts. That's okay.
I think for a lot of people, the idea is, well, how do you begin to do contact tracing?
Okay, so once a case is confirmed from the national laboratory, the confirmed case is notified, the contact tracing team is notified of the case. Once we are notified of the case, we contact the individual who is confirmed, right? And then we ask this individual to draw up a list of all their contacts or the persons who they've been in contact with from 2 days before they've started developing symptoms. So that would include their immediate contacts, which would be the household contacts, as well as their contacts within the home. Now, contact tracing itself comes with some degree of limitations. It's a process that's very laborious. It's very labor intensive. If it's necessary that you have very good contact tracing, you have to have persons on the team that are very experienced and that are very knowledgeable. It is a process that is very time consuming because some contacts can have over 40 contacts depending on their activities. It can quickly overwhelm the healthcare system, especially the persons on the contact tracing team. It's also dependent on because we're dealing with phones and contact numbers, so it's dependent that the persons that we are contacting, their contact numbers are up to date as well. And it also depends on the physical status of the confirmed case. So for example, if a confirmed case is at the time not able to remember their contacts, or they are not in a physical state where they for example, may be in ICU, in that case, if that individual would have the contact tracing app, which we will speak about in a while, we would be able to know who their contacts were and not have to go through a relative of theirs or have to wait until this individual comes to in order to ask them the pertinent questions to get the contacts from them.
So, Ms. Cassius, once the team is out there, what exactly do they concern themselves with, and how do they begin to narrow and give up the time frame that they're dealing with? Because to ask someone, the people that you come into contact with, are we looking at a week, within a week period, within days? How do we determine that?
I think I'm going to allow Dr.
Gomez. Okay.
Yes. I wasn't listening. Could you repeat that question?
No, in terms of the first step for the contact tracing team, so what is the time period that they work with?
Oh, okay. The individual must be notified. As soon as we get the notification, the individual is notified within 24 hours of their status. And the contact list, you allow that individual, because when you notify somebody, in some instances, it's a shock to them. So you have to allow them to internalize the news that you're giving them, the message. And from then on, once they've internalized it, you give them some time to recover, because some persons might break down, some persons might say it's not true, because you do have a lot of news going on in the media. People do read a lot. So you give them some time to internalize that, and then you ask them for their contact. But everything occurs within 24 hours, as long as we can get in contact with the individual.
Okay. So let's go across to Khahlil Louisy. Can you hear me clearly?
Hi, yes I can.
Okay, wonderful. So the contact tracing app, how did you come up with the app, and what was your aim in what this app was supposed to be able to do for us here in St. Lucia?
Yeah, so just a point of clarification, I am not the developer of the app. The technology, the underlying technology was developed at MIT, the Massachusetts Institute of Technology, where I was at the time, and by a professor called Ramesh Raskar, who's one of the pioneers of privacy-preserving technologies. And he developed the underlying technology for these apps, and he created what is called the PathCheck Foundation as a way to provide this service to governments, to different jurisdictions, both here domestically in the US and internationally. So that's where the app was developed, and we came together as a group of researchers, graduate students, and practitioners in public health to work at this foundation and to be able to provide a solution.
So how does the app work?
Yeah, so the app was designed to be as privacy preserving as possible, and that is, it's a hybrid decentralized system in that users download the app just like any other app you download from either the Google Play Store or from the Apple App Store. And what it does, it maintains a location log. So all of the public places that you would have gone to over 14-day period, so 2-week period, it maintains all of those points and it saves it in your phone. No one has access to this information. Even if somebody goes into your phone, they cannot see all of the places that you visited. So it is completely private. In the event that one individual does test positive for COVID-19 or for any infectious disease, really, they would choose to share that location log with the contact tracer. And the contact tracer would then be able to have a visual representation of all of the public places that that individual had gone to over the 40-day period. So it appears like if you look at a Google map, for instance, that's exactly what it looks like. The contact tracer has the choice to delete certain points if they don't think it's necessary. But what it does is it provides a mapping of the spread of the virus, because if you have a number of people who tested positive for the infection and you have all of their location data, you can see those hot spots. The other good thing about the app is that it allows the contact tracer to send out exposure notifications. So if everybody on the island downloads the app and they do come into proximity with someone who tested positive, the contact tracer can send out notifications to all of those individuals and let them know that there was the possibility of exposure.
Right. And in terms of being able to use that app, how simple is it and user-friendly for the ordinary folk?
Oh, it's very simple. You just download the app and it's going to, when you open it on the first time, it's going to ask you to agree to terms and conditions like many other apps. And then it will ask you to choose your health authority, in which case you just select St. Lucia. And that's it. And it's going to be running in the background. You're going to have to enable location services as well. And what that does is it allows the application to keep a record of your locations.
Okay. Now, for the Ministry of Health using this app, how do you see it being able to boost what you do? And is it that there will no longer be the contact tracing, the sort of focal points of the team in being able to go door to door and so forth, tracing people down, if you will, with the app? So would the app now replace that process?
No, it's not going to replace the process. It's actually going to aid us because, like I said, there are some limitations to contact tracing, and sometimes persons don't remember exactly where they've been, who they've been in contact with, who has visited them, some of the activities that they've been engaged in. And by using the app, we are the ones, the contact tracing team, who would be privy to the information that the confirmed case is giving us, pretty much like what is happening now, but it's just going to help to joggle their memory and to help them. Because like I said, sometimes when you get the news, you just blank off, and you may not remember some of the places that you've been and what you've done in the past. So this is definitely going to help us with that.
So apart from being able to assist in the contact tracing, I would imagine that the app is going to be very useful in being able to zone in on home quarantine as well. So, Ms. Cassius, how does the app assist your department?
Okay, so as Dr. Gomez indicated, so the app is basically to be able to track persons and where they have been. Persons are on home quarantine, basically are confined to the home, because home quarantine simply means it's a measure by which you are to remain away from others and you should not have contact with other persons. So with the app, persons in terms of contact with other persons is very limited. So if one is placed on home quarantine, one is expected to remain within the confines of this room or the dwelling in which they're at. So we would not expect these persons to be moving around. So in that case, the app should not show you have been anywhere because you are supposed to be confined. So in that way, it puts a little less pressure on the ministry, in that we know that this person is within home quarantine and they would not have been moving around where we would need to be doing that kind of contact tracing.
And a number of people seem to be confused, or perhaps sometimes they going through the process can be stressful for some people who are coming in, returning nationals, wanting to fully understand what exactly is the process for home quarantine. Can you walk us through that?
Okay, so everyone is to apply online through the St Lucia org website, and there is the option of nationals and non-nationals. So all nationals who are coming back home, there is the home, and they have the option of requesting home quarantine. So the home quarantine form is available online, and they are to complete this form. When this is done, this gets into a database managed by the home quarantine team, and so a listing is submitted to us at the Ministry of Health, where we now have officers, public health officers, who now go into those homes and identify or to assess whether this home meets the criteria and is suitable so somebody can safely quarantine at home. So the criteria for home quarantine would be, of course, a dwelling on its own, or a room with an adjoining bathroom where there is limited or no contact with other persons within that same household. So the assessors, they go in and they do have a checklist. There are certain things that they need to look out for. And one of the most critical things in terms of ensuring that if this individual is living within a dwelling where other persons, where there are other occupants in the home, then there should be very, very limited, there should be no contact with other persons within that home. So once either of those two criteria are met, if the person lives, the individual or individuals who are arriving are living in a dwelling on their own, or they have a bedroom with a separate bathroom. So once any of those two criteria are ideal, then this person is granted approval for home quarantine. The traveler would then receive an approval for home quarantine.
Okay, at this time, we just want to inform our media partners who join us via Zoom that your questions are welcomed at this time. So just indicate as per normal with the whether you could send the text message or just indicate with the waving hand that you have a question, and we'll be able to accommodate you. Mr. Louisy, in terms of, because you mentioned that the app is being used elsewhere, what has been the sort of success rate of the app? Do you know?
Yeah, so there are a number of jurisdictions internationally that are using these technologies. I think the data it's a little early to say conclusively what effect the app has on the mitigation of the infection, but early numbers are suggesting that it can be useful. So Guam, for example, which is an island state similar to St. Lucia in context, has reported success from the app. They have so far, I believe, about a 40% adoption rate, and that has sent out multiple exposure notifications and therefore let people into quarantine or to go get tested. So the governor of Guam has reported that it is successful. In other states, like I think Minnesota is using it, New York is using it, there is the issue of low trust in government, and that has hindered the adoption rate. And so it's too early, I think, to say whether the app is useful or not, especially because they've only launched recently. So inconclusive right now. In some countries and states where it has been for a while, they do say that it is helpful.
Okay. But what do you think can be done in terms of being able to really have the populations to trust that the app isn't intrusive and it is contributing to really containing COVID-19?
Issue is trust in government seems to be low at this time. I don't think, and I hope that's not the case for St. Lucia. It's really about protecting not just yourself, but your community, and information goes a long way. I think that is the best tool to use to just inform people on the, how the app works, why it's needed. Being able to alert people that they have been exposed is important. It helps mitigate the spread of the virus. And so I think, just driving those information campaigns is probably the strongest tool in your arsenal.
Right. And certainly I would think that perhaps, because there was talk about using sort of ankle bracelets here from the Ministry of Health. Is the app now replacing that form of tracking? Dr. Gomez?
Well, we have several devices. Every device has a role. We're talking here about contact tracing. In terms of we're not doing the ankle bracelets. We're doing the wristwatches. Mm-hmm. It's basically for persons who will be on home quarantine and to ensure that they remain within a confined space, which is their home. So the contact tracing app and the wristwatch, their role or their purpose is
but
different.
The contact tracing app, as Nurse Cassius was indicating, can also show that individuals are within the confines of their home. So we're using the two in order to be able to get a firm grasp on home quarantine?
Yes, but like she said, you're not supposed to be leaving the home. However, if persons are visiting your home and you're a confirmed case and they have the app downloaded, then we would be able to notify them.
Okay, so it also has that other function. Mm-hmm. So the idea now is for all St. Lucians, all cell phone, mobile users to download, and it is free.
Yes, it is free on the Google App Play Store.
Okay, so accessing it now for download would be via Play Store. How do they access for download? Khahlil, Mr. Louisy, you there?
Yeah.
So being able to access that.
Yes. So in conversations with the team from St. Lucia, the name that was decided upon was 758 Care Alert. So that is the name of the app, and that's what you would search for in both the Google Play Store and the Apple Store. The app it should be available. It has been submitted to both stores for release, and we were waiting on one final document, which was submitted yesterday, so it should be available at some point this week.
All right, so tell us the name again, 758?
758 Care Alert.
All right, so that is simple enough.
Yeah, and it's important to understand, in terms of trust in the technology, Apple and Google take very seriously these apps related to COVID because of the level of misinformation and disinformation out there. And so they do take time to vet all technologies before they're submitted and allowed for download. And so we have multiple steps to go through before the app becomes available.
But we've also seen so much discussion happening within the US and even perhaps in certain parts of Europe, perhaps more Britain, where there is also distrust when it comes to the social media tech companies. What is the sort of guarantee, or is there any correlation with the use of the app where these tech companies now can utilize your information as well?
Yeah, so it depends on the app. And the app that has been developed for Solution, the app that was developed by PathCheck, there isn't a lot. So we can't even see any information from St Lucia. It's only St Lucia's has that information. The data does not leave the cell phone. So even the contact tracers, unless that person is positive and unless that person chooses to share the information, not even the contact tracers would have that data. So no one does. And that's why a number of jurisdictions around the world opted for our app as opposed to some of the others out there that would allow anybody pretty much to get individuals' data.
So the maintenance of the app in terms of the software, we know that sometimes you can have the glitches. Who maintains the app?
Yeah, the app is maintained by a partner of the foundation. It's fully vetted, called Extreme Solutions. It's an international development company, and they have been working with the team to develop the specific St. Lucia instance of the app, and also will be providing services to the team in terms of the contact tracing tool. So all maintenance will be done through them.
Right. So we've discussed that the idea that some people may not want to do this, but for the Ministry of Health, what number do we have a sort of projected number of St. Lucians that we would want to be able to access the app in order for the contact tracing to be made easier, if you will? So are we looking at least to aim for an 80, 85%, 90% of St. Lucia being able to use the app?
Well, we'd need about 60% of users downloading the app in order for it to be effective. So that's what we're aiming of phone users.
Okay, so 60% of that.
If I may,
yes, of course.
To that, the initial study out of the University of Oxford indicated that 60% was the threshold to ensure efficacy of the app. I think that number has been revised, and it can be lower. Also important to identify is that 60% was in relation to the Bluetooth technology. We are using GPS for St. Lucia, so if in the instance that people do not have the app in an area, because the contact tracers do have location, they are able to mobilize resources to that place, rather than, as opposed to the Bluetooth, who wouldn't give you that location information, and therefore you wouldn't know where to divert resources.
So that makes it a whole lot easier. Dr. Gomez, you were saying?
I say thanks.
That certainly makes your job a whole lot easier, doesn't it? Okay, when can we look? I know you said that you iron out some of the legal things that need to be done, submissions and so forth. But for the Ministry of Health, you're looking out for a rollout. Do we have a projected time frame for the rollout of the app?
Okay, well, I believe Mr. Louisy just alluded to the fact that once the documents have been signed, and I am aware that the documents have been signed, it's just a matter of getting it on the Play Store. So we could possibly be looking at next week.
Okay, so next week for that to happen, and mobilizing St. Lucians into being able to know and things. So in terms of the, give us an idea, sort of public relations of it. Will there be some sort of video to help St. Lucians understand how to utilize?
Yes, there will be a video, and we're looking at engaging the telecommunications companies as well to help us out with it. And also, Khahlil will be lending some help in terms of our communication strategy.
All right, so Khahlil, your role doesn't stop from just being able to have worked on the development of the app, but moving forward in terms of being, the sort of advice that you'll be giving the Ministry of Health in keeping the mobilization for the app, the use of the app. Give us an idea as to what your role will be in the very short future as we begin to roll it out.
Sure. It could be whatever is needed from the ministry. I'm here to support. My training is as an economist, but I study very specifically the economics of public interest technologies. And so how do we use innovations and technology to maximize, the public's utility? That's what I'm interested in, and that's what I do. So anything that can be done using this technology to A, mitigate the spread of the virus, but B, how can it be used in other ways that would support the efforts of the Ministry of Health? Yeah.
Yeah, because post-COVID, and there will come a time when we will be post-COVID, how do you see the technologies like this one, like this app, being rolled over into other aspects? Are there any ideas as to how we can take this innovation and apply it to other areas?
Yeah, absolutely. We're seeing a massive movement toward digitization of health systems, or the transformation of health systems around the world using technologies. I am actually part of the World Health Organization's group on digital technologies for health emergencies, and that's our task, basically, to understand how we could leverage technology and innovation to address issues in public health, which I think for a very long time has been a neglected space. So there's a lot of innovation in primary care, but not so much in population health. And we're looking at how technology can be used to address those problems.
All right, wonderful. Do we have anyone online who would like to pose a question from our media partners? We have Stan Bishop. Thank you, Stan. What's your question?
Hi, good morning, everybody.
Good morning.
Morning, Stan.
I posted the questions in the group. It's basically two questions. The first one is that I noticed that the maximum number of people allowed at social events is still 25. However, I also noticed that Caribbean Cinemas has announced plans to implement spacing in its theaters from December 17th. Does this measure have the Ministry of Health's approval? And that's the first question. And number two would be any considerations for preschools regarding protocols or measures for schools, because one of the flyers that came out yesterday, I noticed that preschools were not included in the measures outlined for the education sector. I know, for example, like even around Christmas time, you're going to find a lot of parents are going to be working extra hours. So any considerations for opening up preschools during that period? Thanks.
Thank you, Stan, for that. Dr. Gomez?
Okay, so we've moved from 25 to 50 persons allowing. In terms of Caribbean cinemas, what was the question?
We wanted to know how because if we had 50 individuals, how does Caribbean cinema accommodates and how does it operate?
Okay,
Stan, that's what you really want to know. How does the operation of Caribbean cinemas fall within?
I noticed they mention rows, but would it stick below? Would it stick to the 50 per theater, 50 persons per theater?
Well, there is also, well, we're allowing square footage, but we're also allowing the 50 persons. But I believe that Caribbean cinemas would go with the square footage, and we are aware that they have places that are marked where persons can sit and cannot sit, so I believe they will work within these constraints.
And the other question pertaining to the preschools. Stan, you wanted to know.
Repeat that question.
Them coming into operation.
Yes, I noticed on one of the 8 flyers that were released by the Ministry of Health yesterday, it did not mention preschools, and I've had parents who were asking me, what measures will be for preschools?
Okay. Well, I'm aware there was some conversation with Ministry of Education yesterday, so I believe that information most likely will be made available at a later date during the week.
Okay, thank you.
Okay, Stan, thank you so much for that. We do have from Nelsia Sharman, I know that we just alluded to it very early, in terms of the app, how do we convince St. Lucians to get on board with using the app?
Well, it will involve a lot of communication, and explanation of the app, and we would really have to appeal to St. Lucians and they're wanting to help the nation, the country, to keep themselves and their families safe, and to try and get the reproductive rate as low as possible in order to end the disease or to diminish the spread of the disease. So it's a lot of education, a lot of communication, like Khahlil alluded, like we've said before. We need to ensure that persons understand exactly what the app is about, and that their privacy will be protected. And it's basically the same process that we're going through as we're going through right now with the contact tracing team that will be the ones privy to the information. It's just that we have the added use of the app in order to help us a bit more in the process.
Okay. Khahlil, the question has arisen again in terms of just a little background information on the app. Can you just walk us back through that?
Yeah, sure. So the app, I think I saw that question on what it is and background. Yes, so it was developed by Path Check Foundation, which is a non-profit organization that's spun up at MIT by a professor called Ramesh Bhaskar, who's a technologist, privacy-preserving pioneer. And if anyone's familiar with MIT, it's really the leading academic institution for technology and STEM. And so a number of governments and private sector, public sector entities came to MIT and came to PathCheck for a solution to address the pandemic. And so what we see now is a number of countries and states from as far away like Greece and Cyprus to Guam and the US and in Latin America, in the Caribbean, using this technology, using this app specifically. So PathCheck Foundation is the name of the developing organization. It's going to be called 758 Care Alert. And it has been submitted to both Apple and Google for release in the Play Store and the App Store, and should be available to St. Lucians shortly.
Wonderful. So Khahlil, explain to us, once that information, it's on your phone, you're being tracked, that information is being seen or received in a central area. So talk to us about on the receiving end, how does that work? Or once go ahead.
Yeah, so it's when you download the app, nobody's able to track you. Need to make that very clear. To help establish confidence. No one is able to track you. No one is able to see your location. Everything stays on your phone, and only you have access to it. It's only if you become tested, you've tested positively for the virus, you would share via the app your location information to the contact tracer, who has a separate tool and can then see a mapping of all of the places that you visited over a 2-week period. So it's only at that point. Nobody else's data or information is being seen. But because you have the app, if you did come into contact with someone who subsequently tested positive, the contact tracer could then send alerts, and you would get an alert saying that you were in proximity to someone who subsequently tested positive, and therefore there's a possible risk of exposure.
And so it takes away the fear of privacy, the invasion of privacy. And so you need not share that information at all if there is no need. So if you've not tested positive, you haven't come into contact with anyone else who've tested positive, that information remains just within your purview. That's just for your eyes only. Yes? So that certainly helps, and I think perhaps quells a lot of the fear that people may have about whether they're being tracked or not. Yes?
Correct. And one other thing, even if somebody does go into your phone, they wouldn't be able to see all of the places you went to either. That's another question that we receive all over the world.
Right. So why wouldn't they be able to see it if they were to take the phone and open up the app?
because all of the location data is encrypted. It's doubly encrypted. So nobody has access to it.
So except when they come with that special tool to help them read it, unlock it, decode it, decrypt it.
It's only decrypted when it's transferred to the contact tracer.
Okay. All right. So that's
and the contact tracer also has the ability to delete locations as well if they think it's private or it's not necessary. It's a simple click the location and delete it.
Yes.
Okay.
So basically, the information that the app will give us, once you have the location, it also gives you the time period that the individual spends there. So you're able to know exactly how much time, which is one of the criteria for exposure. You have a time period. So we can delete places where the individual has spent maybe a minute or 2 or 5 minutes because of the time limit that you have to be there in order for it to be considered a possible exposure.
Okay, wonderful. Ms. Cassius, at home quarantine, I mean, we've heard of the instances of individuals inviting people over, parties are being held. Can you speak to us about the sort of gravity of these incidents and how it makes what all of you within the health sector, what you do that much more difficult?
Okay, so like I indicated earlier, home quarantine is a measure or it's a process because a series of steps occur during that time. So it's a measure in which this individual or individuals need to be alone, be on their own, apart and away from other persons. So this means that this person should not have any contact. So you are not allowed to go out, neither is anyone allowed to visit you. So no visitors are allowed. And again, the whole aim of home quarantine is to ensure that if this person does develop signs and symptoms of the virus, that the possibility of transmitting it to others is reduced. So it is important that someone who is on home quarantine stays within the confines of the apartment or the room in which they are at, and no one is allowed to either visit or no, they are not allowed to even interact with other persons within the home if they are within a bedroom and bathroom setting, and there are other occupants within the home. So in terms of, we do have gotten reports of persons who have breached home quarantine. And so there is a process. Let me just indicate that we do have home quarantine officers who are responsible for contacting everyone who comes into the country in terms of our nationals who are on home quarantine and monitoring them in terms of trying to find out whether they have developed any signs and symptoms during the 14-day period. And let me reiterate that the quarantine period is indeed 14 days. We know we do have persons who are within the public health facilities, the state quarantine, and they are tested on day 7, and they are, once they receive the negative result, then they are sent home to continue the 14-day period. So we have been getting reports of persons breaching home quarantine. There is a process where those officers would inform us, or we do have members of the public who will report as well. We do contact those persons within the Ministry of Health. We do contact those persons to find out if in fact there was a breach in the quarantine. We also have the process where those names are submitted to the police. We do get a lot of support from the police, where we do submit the names and the directions to the home in which the individual is staying at to be able to do some further checks for us. So we have also had instances that we are all aware of persons who have actually been taken away from home quarantine into state quarantine. So there is a process. Persons are given the home quarantine guidelines when they do arrive on airport, and also the contact of the officer who would be monitoring them in the event that this officer has not gotten in contact. Because as Dr. Gomez indicated, telephone numbers trying to reach persons on their mobiles can be quite challenging. So they do have that contact information of the officer who is to monitor them at home, so they too can make that contact. It's again very important that persons remain at home, and we encourage persons who, if you have applied for home quarantine, to make the necessary preparations. Get someone to put groceries into the home, into the house, you know, and ensure that you do have your medications, everything that you would need within that time, because you know that you will not be allowed to leave the home. Persons may bring items for you, but they need to at least leave it on the door or leave it in the balcony, because there should not be that handing over, because this is what we try to reduce. You know, persons coming over to drop off items. So it is very important that persons do those kinds of preparations when they do apply for home quarantine.
And for being checked, because some people have indicated, well, the nursing team, do they get the temperature checks or just any form of follow-up from a nurse?
Right, so this is where the health officers, the public health officers, those who call the individuals at home, they do ask for any signs and symptoms, whether they do have a fever. We do have persons who do have the thermometers, so they do the temperature checks at home, and they report to the officer whether there is any cough. And the officers do have a database in which all of that information is entered. Persons are called every day or every other day to be able to check on them and see if there is any decline or any symptoms may have arisen on any particular day. So persons do have thermometers that they do check the temperatures, or we ask, of course, persons would know if they have any fever, if they have felt feverish over any part of the day, so they would report that as well.
Thank you for that, Ms. Cassius. And so we're coming into our winding down moment, and I want to be able to give final words to, let's start with Khahlil. You still with us?
Sure,
all right, so we're just taking,
thank you.
Yes, just taking some final thoughts from you.
Yeah, I think, it's great that St. Lucia is using this app and is exploring technology to augment existing processes. I think it's great. My hope is that it will be useful to the public. I hope that they do trust that this is a privacy-preserving piece of technology, and they use it to protect not only themselves, but also their families. So.
Wonderful, and thank you so much for all of your work that you're doing in the diaspora as well.
Thank you.
All right, so Dr. Gomez?
Well, yes, same here. We know that this is something new to St. Lucians. It's a new technology, but we will be doing further education on it and more communication. We just want St. Lucians to know that your privacy will be protected. It's basically the same process that we're going through right now. Your information remains with the contact tracing team as is happening right now. And we just want to appeal to you to, when this does come into effect, that persons will make use of it and help us to help you and your families and keep St. Lucia safe.
Thank you so much. And Ms. Cassius, as we close, how many people do we have a total on the people in quarantine at this time? A home quarantine, I should specify.
Yeah. Currently, we have over 300 persons in home quarantine at the moment, and we are expecting many more persons to be coming home. So again, I just want to encourage persons to apply online for home quarantine. Please allow a minimum of 7 days to process application. And of course, that approval will be done once the inspection of your home has deemed adequate and suitable. Then this approval letter will be sent so you can travel. And to also encourage persons to be reminded that quarantine is 14 days, and you are to have no contact with other persons, and you have to be within the confines of this home for that 14 days, and of course not having any visitors as well, to reduce any possibility of virus transmission if you do develop any signs and symptoms of the coronavirus.
Thank you so much for that. And for those of you who will be home quarantine, we know that Christmas is just around the corner. Let that be your gift to your friends, family, and all of St. Lucia, that if you are in quarantine, home quarantine, you adhere to all that they're asking you to do. It's only for a short period of time. So let that be your gift to us when it comes around at Christmas time, and if you are in home quarantine. Let's say thank you very much to Surveillance Officer Dr. Dana Gomez, the Principal Nursing Officer, Nurse Julita Cassius, within the Ministry of Health, and of course to Khahlil Louisy. Thank you so much, who worked on developing, part of the development team of the 758 Care Alert, and he's also a researcher at Harvard University. Thank you so much for all of your work. And thank you to our media partners for your questions. And thank you, St. Lucia, for watching. Let us also remind you that once the app is rolled out, please do your part and simply downloading the app. And that is your added measure for keeping yourself, your family, and all of St. Lucia safe. I am Lissa Joseph, signing off from the Information Command Center. Until next time.